So my name is Emma Watson, so I am the business analyst for the Data Sharing Partnership team. So we are a team of 4 based at Kirkland who hold partnership posts and who are funded by the Lanarkshire Data Sharing Partnership Board partner agencies of NHS Lanarkshire, North and South Lanarkshire Council. So our team are here to provide support and advice in data sharing across organisations for all staff. The Lanarkshire Data Sharing Partnership Board exists to deal with all things pertaining to data sharing between NHS Lanarkshire, North and South Lanarkshire Council, Police Scotland, Scottish Fire and Rescue Service and the Scottish Ambulance Service. So since the pandemic, there has been an increased requirement for data sharing between NHS and other organisations. So our team provide support to ensure that the data sharing is safe and supports effective patient care. So the LDSP board were asked to develop and implement a formal process that would enable council staff to access health systems when necessary. So it was recognised that this had not been robust enough up until that point. At the onset of this process, talks took place with departments such as data protection, fair warning, IT support and others, and it was recognised that governance documentation and processes were going to be the key to ensure adherence to regulations. So a new process was introduced for completion of the relevant documentation that is supervised by the business analyst. This can include data protection impact assessments, information sharing agreements, standard operating procedures, fair warning guidance documentation and so on. So during implementation we have realised that some of the documentations are quite laborious for services to complete. Due to this, the data protection team have developed an overarching DPIA for access to TrackCare, Clinical Portal and Morse so that services can be added to this rather than having to complete their own from scratch. We also have template documents for additional support, so this is more efficient and user friendly. The LDSP board also produces information sharing agreements for health and social care staff and for children's services, which means that if a service does require access to health systems and that they're part of the health and social care partnership, they're already covered by the existing IAC. So part of my role is to support the services throughout the process and be a conduit for the LDSP board. Once the necessary documents are complete, so we liaise with the relevant IT application team to ensure role-based access is put in place. We are working closely with our digital colleagues to assist teams, so for example the digital training team, to ensure that teams have the correct training for our NHS systems, and also our service desk colleagues for when a non-NHSL member of staff requires to raise a help desk call. So we're also ensuring that teams are well supported by digital and that our team are here to provide additional support and guidance when required. Our team also maintains a comprehensive record of non-NHSL staff who access a health system so that we can ensure accounts are created and disabled and our records are kept up to date. As the process matures, we are finding more situations that require support and we're continually monitoring and updating our processes to provide the best support possible for all staff.